How's it going, Modern Manual Therapy viewers? It's Dr. E, and I'm here with Dr. Andy McLarkey from Soul PT in Beverly, Massachusetts, one of the home of eclectic approach courses. And I'm going to be debuting modern strength training this weekend, first weekend of August 2017, to date this video with Dr. Kyle Coffey this weekend. So I just wanted to film a quick video on an easier way to mobilize the cervical spine. So just taking a look at Andy's neck, I don't remember, it's been a while, it's been a year or so.
Sitting here.
Yeah. Okay. Can you zoom in on his neck? Or just like this part? See the stick? You can like also move the camera around if you want. Okay. So just like this part right now? Great. Just give it a little chin tuck, and I'm just going to see if he's limited one way or the other. In a tuck.
More of that.
Yeah, a little bit.
Way.
Yeah. Looked like you kind of twitched a little bit, and there's a slightly different end feel. It didn't really look that significantly different, but overall, an easier way to mobilize the neck, knowing that you can't be specific, is to kind of give the patient a little bit better control of it. And if you accept that, like if you're Maitland trained, that P to A's kind of work well as mobilizations, I don't think you really need to side bend someone all the way at a specific level and hammer away at that painful point. If you just kind of feel in supine with your fingertips on each side of the paraspinals for a little bit of increased tone, the patient may even indicate, oh, that's the spot. You don't need to hammer away at that, but if you just kind of touch that lightly and either kind of press back and forth on both paraspinals interchangeably like that, left to right, or even have them just wiggle their head into it, often that tone disappears. Then when you recheck for that range of motion or the mobility deficit, then it's usually better. So let's give an example of that. Go ahead and line your back. So if Andy was limited with retraction and side bending a little bit to the right, it would also come out in supine if he was still limited. It's still just a bit limited. But overall, what I was talking about is if you just take two fingertips and just kind of alternate on different portions of the paraspinals, you or they may feel that there's a spot that feels a little stiffer or has increased tone or tenderness. Is there anything like that? Not really feeling a huge difference. If there was, and let's just say there's one here at upper cervical spine, he's not really feeling it, what we tend to do is often just mobilize that and oscillate it until we pretty much break the nervous system into releasing tone. I think an easier way to do it is just to palpate for that increased tone and then just have them rock into it. You can just assist them or just have them completely control it. So go ahead and just rock lightly into my fingertips. And usually after about 10 to 20 seconds of that, the tone will decrease and you can kind of move up and down the paraspinals until the tone is normalized. If they don't feel like moving, or you just feel like kind of doing more of a passive mobilization, you can just rock back and forth. And what I'm doing is I'm just, almost as if I was just like pressing keys on a keyboard on both sides of the spinous process, just lightly rocking back and forth. So you can't be specific anyway, and this is a lot more comfortable than taking someone to end range at a tender point and just mashing away at it. And you'll find you'll get the same results about increasing mobility in loading. So after you recheck in retraction and side bending, they should be able to have full passive end range. And if they still have a little pinch at the end, you could always just give a little resistance. So go ahead and push to the right into my hand and hold it and relax. Then after that, they should be able to do their own retraction and side bending. So thanks for watching. If you have any questions, comments, just leave them on Facebook or YouTube. Subscribe to our email list to get daily blog updates, and check out Modern Manual Therapy, Instagram, Facebook, and YouTube, and all our products on edgemobilitysystem.com.